Yes, we did this Phase I trial including patients with Richter transformation who were either previously untreated or had received R-CHOP chemotherapy but had responded to the treatment, so no refractory Richter transformation were included. Overall, we included 49 patients, and these patients received a treatment of the combination of the BTK inhibitor Zanubrutinib plus the checkpoint inhibitor Tislelizumab. And the treatment was continuing primarily with an induction treatment, then followed by a maintenance treatment with the antibody infusions every 3 weeks for the patients. And the analysis, which my colleague Osman Al-Sawaf presented, shows an overall response rate of 58%. And with that, the hypothesis of the study, where we wanted to reach an overall response rate of more than 40%, was achieved. The median progression-free survival was exactly 10 months. So this is a little bit better than what we had in the past, but I think more interestingly is that the duration of the remissions in those patients responding, the median duration has not yet been reached. So we do see really long-term responses in patients, and also the median overall survival looks fairly good in those patients. We do have a couple of patients who went afterwards to allogeneic stem cell transplantation, which was allowed, and among those 7 patients proceeding to allogeneic stem cell transplantation, most of them also did very good. With respect to the safety, we did see primarily infections in 20% of the patients, particularly urinary tract infections, also several COVID infections since we recruited during the pandemic. But with respect to the typical side effect profile of the BTK inhibitor, there was no atrial fibrillation, and only 3 patients had a worsening of their hypertension. So overall, the treatment was well tolerated.